Parasympatholytics. These are called as anti-muscarinic agents as these drugs blocks muscarinic receptors. And the classification of parasympatholytics is as follows. It is classified into natural alkaloids, semi-synthetic derivatives and synthetic derivatives. The natural alkaloids contains atropine and scopolamine, whereas semi-synthetic derivatives contains atropine methonitrate, hyoscine methyl bromide, homatropine, benztropine, ipratropium bromide and tiotropium bromide, whereas synthetic derivatives contain pyrazepine, telenzepine, procyclidine, oxyphenonium, dicyclomine and glycopyrulate. And coming to the natural alkaloids, atropine and scopolamine, these both are obtained from the plants of Solanaceae family, and the atropine is obtained from the leaves of Atropa belladonna or Datura stramonium, whereas scopolamine is obtained from Hyoscyamus nigrum and Scopolia carneolica. Coming to the mechanism of action of muscarinic blockers, these atropine and related drugs, these block the cholinergic muscarinic receptors by acting as competitive antagonists of either acetylcholine or directly acting cholinergic drugs. What are the pharmacological actions of parasympatholytics? In a nutshell, I would like to say that these parasympatholytics actions are completely opposite to that of parasympathomimetics. On the cardiovascular system, when small dose of atropine are given, it causes temporary bradycardia, and in the high doses it causes tachycardia. Whereas atropine-like drugs will antagonize the fall in BP, which is caused by cholinesterase, whereas atropine alone doesn't affect BP. This means that if there is general fall in BP or general rise in BP, these parasympatholytics will not affect at all. These will try to increase the fall in BP, which is caused by cholinesterase only. And coming to the GI tract, it has spasmolytic activity on GI smooth muscles. Spasmolytic activity means relief from the spasms of smooth muscles. As these causes spasmolysis, that is, it decreases the contractions of smooth muscles caused. This spasmolytic effect is mainly due to the contracting effect on acetylcholine. That is, these drugs will completely act opposite to that of cholinergic agents, as these drugs act by preventing acetylcholine effect. These has spasmolytic activity. Not only spasmolytic activity, it will block the increased tone. Increased tone means the contraction of the GIT muscles will be increased when acetylcholine acts on it, whereas by using these spasmolytic agents, that that increased tone can be blocked, and also GIT motility is blocked. The secretions of GIT like gastric acid secretions are also blocked by using these parasympatholytics. On the respiratory tract, it will cause inhibition of bronchial secretions and also causes dilation of bronchi. As there is dilation and inhibition of bronchial secretions, there will be temporary relief in case of dyspnea and asthma patients. In the eye, it causes mydriasis, and that mydriasis is due to blockade of cholinergic influence and a slight increase in adrenergic dominance. Generally cholinergic influences causes miosis. As these parasympatholytic counteracts the cholinergic influence, it causes mydriasis. It also causes cycloplegia. This cycloplegia is due to paralysis of ciliary muscles of lens. When this cycloplegia causes, the focus on nearby objects can no longer be adjusted by lens. This mydriasis and cycloplegia is caused after either local or systemic use. And these mydriasis and cycloplegia are important phenomenon when examining the eye of a person. On the urinary tract, it has a spasmolytic effect. It is same as that of GIT. This spasmolytic effect on ureter is very much useful in the treatment of renal colic. This renal colic is sudden pain due to the presence of stones in the kidney, and that pain can be treated by using these parasympatholytics. And sometimes, urinary retention will be caused due to the complete relaxation of bladder. On the skin, it has anhydrotic action. This anhydrotic action is due to the malfunctioning of sweat glands. There is complete absence of sweat in anhydrotic persons. Due to this anhydrotic effect, there is also rise in body temperature, because the sweating is a phenomenon where our heat in the body will be completely gone, and there is some kind of coolness to the persons. When this sweating is completely absent, there is automatically there is decreased elimination of heat from the body. As a result, there is a rise in body temperature. As these parasympatholytics have inhibiting effect on secretions, it has anhydrotic action. On the CNS, atropine has no significant effect, whereas scopolamine will cause depression, excitement, and delirium at high doses. That too in cats and dogs. This delirium means it is confused state of brain and also decreased awareness on the environment. And therapeutic uses includes atropine can be used as pre-anesthetic, and it is also used as antidote in organophosphate poisoning and carbamate poisoning. These are irreversible anticholinergic agents. These acts irreversibly by blocking the enzyme acetylcholinesterase. So whenever poisoning takes place due to the use of these drugs, atropine can be used in the treatment, and it can also be used as eye drops during the eye examination. Homatropine is also used as homatropine is also used as solution for the topical use in the eye. It also causes mydriatic and cycloplasia, which is very much useful for the eye examination. But the effects of homatropine are very shorter duration when compared to the atropine. Coming to the glycopyrulate, it is used as pre-anesthetic. Adverse reactions of parasympatholytic includes all these things. The most common side effects are dryness of mouth, constipation, blurred vision, and photophobia. Photophobia means the person will be very sensitive to the light, either the light in the house or the bright light that is caused by the sun. They will be very much sensitive, and it causes pain and discomfort to the patient. It causes urinary retention as the bladder muscles are completely relaxed. There is decreased sweating, which is anhydrotic action, as I already said earlier. It also causes glaucoma. One thing I would like to say, one interesting thing about the parasympatholytics is that one useful aspect in treating a disease may be adverse effect in another. Like for example, if these drugs can be used to treat renal colic, that is the pain that is caused due to the kidney stones in patients. When this atropine is used for the treatment of renal colic, it may give relief from the pain that is caused due to the kidney stones, but it will cause mydriasis and cycloplasia. There it will be an adverse reaction because the patient requires only the relief from the pain, but the person is getting the useful effect, which is relief from the pain, but also the person is getting mydriasis and cycloplasia, which is adverse effect. So the effect of this drug, sometimes it can be therapeutic, whereas in that same scenario it can be a adverse reaction. Coming to the atropine poisoning, overdosing of this atropine may cause poisoning or toxicity. This atropine poisoning may be caused due to accidental or suicidal intentions, and in adults greater than 80 mg orally can be toxic, and in infants and young children just 10 mg can be toxic. And the symptoms of this atropine poisoning are dry skin. Dry skin means it will be as dry as bone, and hyperpyrexia means increased body temperature, flushing of face, not just normal flushing, the face will turn as red as beet, and it will cause mydriasis. Photophobia, as already said, sensitive to the light. Dry mouth, slurred speech, that is difficulty in speech. The person can either mumble in themselves, or the speed of the speech can be increased to a very abnormal level, or the person can be very difficult for him to speak. And the micturition difficulties, that is urination difficulties, as the bladder muscles completely relaxes, the person may not be able to urinate. Confusion and delirium. These drugs also causes hallucination and tachycardia. Not only these side effects, these may be followed by coma, cardiovascular collapse, which may lead to cardiac arrest and death of the patient, and respiratory paralysis also. It is a very fatal condition. And when compared with the atropine, scopolamine is very toxic. Before proceeding for the treatment of any toxicity, we should identify whether what kind of substance has caused the toxicity. So to diagnose the poisoning is due to atropine, first we should administer physostigmine intramuscularly, and the dose is 1 mg. When this physostigmine is administered, if the patient doesn't show salivation, sweating, and lacrimation, then we are certain that the intoxication is due to atropine only. When we make sure that the poisoning is due to atropine, then we proceed for the treatment. The treatment will include 2 mg of physostigmine is given intravenously or intramuscularly, whereas in the children only 0.5 mg is given, that too in the form of slow infusion. This physostigmine will cross blood-brain barrier. As it crosses the blood-brain barrier, it will counteract not only the peripheral toxicity, but it will also counteract the central toxicity if anything has taken place in the brain. In addition to physostigmine, to prevent convulsions and delirium, diazepam is given, which is given intramuscularly. And in addition to all this treatment, the patient should be given gastric lavage, artificial respiration. If there is increase in temperature, he should be given ice bag sponging to reduce the fever. And all the supportive measures that are required for the patient should be given.